The London Podiatry Centre offers advanced conservative and surgical care for the foot and its associated structures.
Hello, this is Ron McCulloch, consultant podiatric surgeon at the London Podiatry Centre. Today I'm going to talk to you about a very common cause for heel pain in children called Sever's disease, and we will cover a few other causes of heel pain, but Sever's disease is by far the most common and frequent reason why we see children with heel pain. So what is Sever's disease? Well, the heel bone, when it's still growing and developing and enlarging, has an area called the growth plate. So this is the heel bone, referred to as the calcaneum, and this red line represents roughly where the growth plate is. So this area has rapidly dividing cells that allows the bone to grow and get bigger. That makes it a bit more vulnerable and a bit weaker than the rest of that structure. So if you have children who have susceptibilities to irritation of the growth plate, then that's often when the pain will manifest. Now, what are those susceptibilities? What are the causes? Well, for example, one well recognized and more research cause is abnormal pronation and collapse of the arch. So when the foot is unstable, when it collapses excessively, it puts too much stress on the heel, and as a consequence, a child can get symptoms. There are other causes if the child has a rapid growth spurt, and particularly if the calf muscles therefore are tight, then this can also cause Sever's disease. But interestingly, this hasn't been shown to be as big a connection as abnormal pronation. Then, of course, there's very much the activity that the child does. So if the child is very active in sport, particularly high impact sport, and we see far more kids who have Sever's disease who, for example, play football and rugby, and there's reasons for that, they're often more susceptible to the condition. There are other causes. There is a link between Sever's disease and children who are overweight, and there's even some studies that suggest perhaps in some small percentages vitamin D deficiency can play a role. But the causes will be discussed a little bit further in this video, but those are some of the fundamental ones. So who gets it? Well, anybody, any child can get it while the growth plate is open, but children are particularly vulnerable at around the ages of 8 to 14. But we certainly see children of 6 years old who have this condition as well. Obviously, as soon as the growth plate closes, then it's no longer possible to get Sever's disease. So how do you diagnose this? Well, in terms of diagnosis, the best way to diagnose it, if we have a look at this foot model, is you squeeze the foot from side to side where the bone is, where the heel bone is. And if you cup or squeeze the bone and it causes acute pain in the bone itself, all around the heel, that is very likely to be Sever's disease. If you squeeze here at the back where you have this cord called the Achilles tendon, you may also get some pain, but that would be because the Achilles tendon is also inflamed and irritated, and it is quite common to have Achilles tendon problems when you have Sever's disease. So you have to have that tenderness in the heel when you cup it. That is the absolute key diagnostic criteria. Now, we rarely do x-rays because they're not that useful, frankly, unless it's very significant bone damage. You can do an ultrasound scan, but to be frank, the ultrasound really looks extremely irregular. When you look at a heel bone on ultrasound that's still healing, and look at the growth plate, it's very fragmented, it's very irregular, and it can be quite difficult to make a distinction between normal development and Sever's disease. MRI can also be done, but it's really only done for unusual cases where perhaps we suspect something called bone edema, where there's inflammation in the bone, or perhaps even stress fractures, which is perhaps far less common. I've seen very few kids with those type of conditions. So it's mainly, in other words, a clinical diagnosis. What are similar conditions? Well, I've mentioned them already. Stress fractures would be one, bone bruising of the heel bone would be another, and Achilles tendinopathy would be another. There are a few other structures around the heel bone. There's tendons on the inside and on the outside that could become inflamed, but it's very unusual for kids to have those kind of symptoms from the ages that Sever's disease occurs. So that would be quite rare. So what about self-help measures? What can we do to actually treat this condition, perhaps as a parent, before even necessarily coming to see us? Well, the first and most important thing is avoid having the child in flat shoes like Vans or Converse. Wear a shoe with a bit of a chunky heel and make sure it offers some stability, especially if you suspect that your child has flat feet. So one shoe that's excellent and that's very it's very unlikely it's going to cause any problems. It will probably do them some good regardless of their foot type, would be the Asics GT2000. Okay. This is a shoe that has a reasonable heel inclination and good stability. And there are very few stability shoes for children that are high quality, and this is one of them. In a moment, I'm also going to talk a little bit about other treatments, but that's one shoe. In fact, let's just talk a little bit about the other major activity that seems to cause Sever's disease, which is football and rugby. Now, this partly happens because football boots are notoriously flat. They don't usually have any heel inclination at all, which means more stress on the heel bone. Obviously, particularly when the child is playing on hard ground, it also doesn't offer any shock absorption. So what we tend to recommend is a football boot with a heel inclination, but unfortunately there are very few of those around. There is one called the Asics Tigreor, Tigreor, but it's very difficult to find. And we often advise that children go into a rugby boot that has a high heel inclination. So this is called the Oxen rugby boot. This is one of our preferred recommended type of boots because there is a mixed stud version that has a centimeter height at the back, and that will really reduce the stress on the heel and therefore greatly help children. So Oxen, which you'll be able to find online, is an excellent company to consider. What else can you do from a self-help measure perspective? Well, often if you look at the literature, there will be discussions about calf stretching. Gentle calf stretching is okay, but it also has the danger of aggravating the condition, particularly if the heel's already sore. So we generally don't recommend that until a little bit later on when the heel is actually settled down. Now, one of the key things that we will do in our facility to manage the problem conservatively is gait analysis, because usually kids have a biomechanical vulnerability, as already discussed. So that vulnerability could be anything from a leg length difference to an abnormal hip position to an abnormal knee position to various imbalances within the foot. For example, something as straightforward as bunion deformities that are beginning in children will destabilize the foot, make the foot collapse, and potentially cause Sever's disease. To be honest, it's beyond this talk to talk about all the possible biomechanical causes. Suffice to say that the most important thing is when we see our children, we do in-depth gait analysis, and that will give us the information we need to be able to provide the right treatment based on, the biomechanical presentation. And basically those treatments are going to consist of the right shoe. Often we do have to produce a support for these children of some description to stabilize the foot, and of course rehabilitation, and then the child will work with our physiotherapist to deal with any of the imbalances that might have occurred. For example, they may have right Sever's disease because they're dropping their hip a lot and therefore getting a lot more force on the right side, and that could be the result of a leg length difference. Now we can deal with the leg length difference, but that doesn't change the fact that there's going to be pelvic tilt that requires specific rehabilitation. So that's just one example. Now, in terms of surgical management, there is no real surgical management for Sever's disease. That's just not necessary. I guess the most intense treatment that we would consider would be to put the child in a cast. I've only done that once or twice in my entire career. It's very rarely required. And in that situation, before we do that, we would actually request an MRI scan just to look at things in a bit more detail. So I hope this overview is helpful. It is a common condition. We see it all the time in our facility. It is usually self-limiting, but there are biomechanical vulnerabilities. And if we deal with those vulnerabilities, then the chances are the child will get better much quicker, and as a result be able to return to their sports. Thanks.